Hi, and welcome back to Broken and Brilliant. I'm Carrie O'Toole with Carrie O'Toole Ministries, and I'm joined again by Dr. Larry Sanders, who is a psychiatrist. And we were talking on the previous podcast about how you got into psychiatry a little bit, and how the question asked of you was, why do you want to do this? And you talked about how if you haven't experienced it, you can't really help others,
right,
because you're not in the place emotionally, psychologically, spiritually even. Would you mind sharing a little bit about your life?
Yeah. Because, you have to have experienced really tough things to understand what's that like and to have empathy for others. And I've seen a number of people, where they tell someone about a bad thing that's happened to them, and if that person they're confiding in hasn't had anything, they'll say, well, just blow it off, or just think positive, or pull yourself up your bootstraps, or even some Christians will say, well, pray and God will deliver you, and you go pray and God didn't deliver you, and they say, well, maybe you're not really a Christian. And what it really is those people have no understanding of what real issues are because they haven't dealt with them, or they've suppressed their own so much that they're not dealing with them. But yeah, I had an interest in psychiatry since I was a child because I lived in a very dysfunctional family, and people who I could see were intelligent were doing things that didn't make any sense. And I've always wondered, why do people do what they do? So I grew up in a family where there was a lot of physical abuse, from the time I was an infant. A lot of emotional abuse, public shaming, a lot of neglect. It was really rough, and
I think a lot of people who would grow up in that type of situation, you would kind of think of them almost being held down in the world, and it's almost like a dooming sentence of a life filled with poverty and continued abuse and continued harm. And that didn't happen to you.
Well, it did, but I guess I just, as my father later said, son, there's really no quit in you. To me, I've always had this idea, ever since I was little, that there's a way to fix it. There's a way to make it work. There's a way to resolve it. And so to me, it's always about looking for a way to make it work rather than giving up. Because one day, this is kind of a silly example, one day I'd ridden my bicycle down to where I work, and it's all downhill, about 1,000 feet, about 20 miles, and got started late as usual. And then as I'm coming, and I hadn't ridden my bicycle in several years, as I'm coming back, I'm really wiped out, just really tired. So I laid my bike down, I was laying in the grass trying to rest, and I noticed it was getting darker and darker, and I still had a long ways to go, probably 3 or 4 hours to go, and it was all uphill. And I thought, this is kind of like life. It keeps moving whether you decide to or not. And so quitting is not really an option. Because if you quit, you know what's going to happen. You fail. And yet, if you persist, you almost always succeed. Sometimes not in the way you expected, but you almost always succeed. And so somehow I had that idea as a child, that quitting was just not an option. One, maybe I just was thinking as we're talking, in my family, had you quit, you may have died. Because there was no one who would help, no one probably who cared to help, no one who recognized it, and so you were on your own to really make it work for you, because it was really tough. I did have an aunt who was a very compassionate lady who showed me a lot of love and unconditional love. That's probably my saving thing. It really was, and very, very neat lady. But anyway, after growing up, I've had many things happen. I had a daughter who died 6 years ago. She committed suicide after struggling years with bipolar depression. My wife died just less than 2 years ago after a motor vehicle accident. She had 15 years ago and suffering tremendously from lots of things, and had really suffered a long time. And people often say to me when they learn these things, wow, you've really had a really hard life. And it's like, Yeah, I guess it is, but it is what it is. And someone asked me a question the other day that I would have answered different 15 years ago. But they said, if you could go back, what would you change? And I said, well, there's a lot of things I didn't like, and there's a lot of things I wouldn't wish on anyone. But in reality, they helped make me who I am and gave me the ability to help people. So oddly enough, I wouldn't change anything. I wouldn't change anything. Because without that experience, you're useless in my field. You're just useless. So, you know.
Well, truly, and I mean, having you as a doctor, that was one of the first things that I was drawn to, and somebody had referred me to you, and I was scared. I didn't know if I wanted to. I certainly didn't want to go see a psychiatrist. I'd never seen one before in my life. I didn't know what you did. I really, truly didn't. It was just kind of like those crazy people go to psychiatrists. That's all I knew. And so here I was in a very disturbing place, didn't know what to do. And I remember coming to see you, and you treated me with such compassion. And in fact, you told me the story about your wife and her car accident. And it helped me know, you know what suffering is. And I'm not crazy. And this is what happens when you go through really horrific times. It's not that you're, there's something horribly wrong with you. Your body is responding to really, really difficult circumstances. And that's that's how it responds. And that's a normal reaction to that. And it was really amazing for me, because that kind of helped me, first of all, to trust you, to know that I could continue to see you and that you would look out for my best interests, and there wasn't something crazy going on. But also you helped me normalize what felt so crazy to me and helped me move out of that. And that was such a blessing, because, when you're in that place, as I know you have been several times in your life.
It's hard and it's scary, yes.
And when people don't understand how hard and how scary, and they do say the little platitudes, anybody who has suffered, really from losing somebody so suddenly, or a mental illness, or just sudden, really shocking things, or intense, long drawn out things, or a sudden trauma, or any of those types of things. If you've never experienced that, it's really hard for you to speak into somebody else's life.
Yeah, it's the best you could do is just kind of be there to listen, and that's a good thing. If you're a good listener and don't try to solve it for them, actually the best therapists are great listeners who only intervene when you're stuck. Because there's a Marcus Aurelius, who was a 2nd century philosopher, had something that I thought was a really cool statement. Everyone has within themselves what it takes to get well. But we don't seem to be able to consciously know what we're thinking unconsciously. That's where God left that loop out of our brain to force us to interact with other people. Because it's amazing when you're talking to someone you really trust. At least for me, what was the most shocking thing to me at therapy was I didn't know I'd been thinking that. And what I was thinking wasn't ill towards people. It was actually, I was really felt better about who I was because of now knowing what I really thought. But it's amazing stuff.
Well, and I've heard a statement that the brain that got you into this is not going to be the same brain that gets you out of this, meaning you need somebody else to speak into your life. Because if you have been thinking in a way that's detrimental based on how you were raised or whatever happened to you, and you can't figure out how to stop thinking that way. You need somebody else to speak into your life and say, here's how you do it. I've been there. Let me lead you out of that place.
Or you see where they're making the wrong decision. So people, because when we've been through it, we've come to resolve it in some way or another. But so when we try to process it again, we keep making that same blind end loop statement. This happened to me because I was bad. And and so when I have people who come in and really think that they're a bad person, and so I kind of, as a shock thing, say, well, how many people have you killed? None. How many people have you raped? None. How many children have you abused? None. So where's this badness? There's really no evidence that they're a bad person. And so it's like, well, then why do you think you're a bad person? Well, that's what they determined as a child. And so a lot of times what a good therapist does is see where you're stuck and challenge you with truth and to help you think about it differently, because it's very, as you mentioned, it's very hard to do that on your own. Because you've already processed this many, many times, especially unconsciously, and you come to this conclusion. And if it's erroneous conclusion, you stay stuck. And so it's a good listener is one of the most valuable things. But even the Bible, I always found it interesting, like the second verse in the first chapter of James, consider it pure joy when you face trials of various kinds.
Yeah.
Yeah, I'm not sure I get the pure joy part. But what he says is because trials build experience, and experience builds wisdom. So without trials, you can't have wisdom. Without wisdom, you can't help anyone.
I remember when I was seeing you, you said, did you ever ask God to use you? And I said, yes. And you said, aha. Because if you haven't suffered, you can't help anybody.
Right, you can't. You cannot. Yeah, I know. So I have now, with my daughter dying, I have what I call the unwanted ministry, which is I have a number of people who see me because they have a child who committed suicide, and they know I understand that. And if you haven't
and you're
had
not
that,
going to give the platitudes, you're not going to push it aside, or it doesn't make you so uncomfortable that you can't talk about it. You've lived it.
Yeah, I mean, if someone said, oh, that must really be bad, you go, you just want to slap them. It's like, you have no clue. It is the most gut-wrenching, horrid thing you could ever imagine in your life. And so, yeah, I have the unwanted ministry. So God uses me.
I have an unwanted ministry as well.
And, you know, it's about how do we use what we've been given. And what I've actually found, believe it or not, is I'll just say, for me, every strong Christian I've met has had really hard things. I have never met a good, strong, deep, wise Christian who has had an easy life. Nobody said, my life's been easy, I think I'll start serving God. Most people say, I can't do this anymore. I have to depend on God for this, because it's true. You have to depend on God because you can't do this alone.
Well, and how did you get through that? I just think about having your daughter commit suicide, and you're a psychiatrist, and she had bipolar. And what did that do to you?
You know, the one thing that really helped me through was that I knew that we did everything we could. That really helped. Because she wanted me involved in her treatment, which was surprising for a girl who was only 14. And both in therapy and with the psychiatrist. And because the psychiatrist knew, he even said, you know more about bipolar than I do. So I would toss out options, but I told him very specifically, I don't want to make the decision because I'm too close to this thing. I'll just say, here are the studies, here's what we know, what do you think based on what you know and on what the information says that we should do. And unfortunately, what was available at the time wasn't enough. And bipolar is a very wicked condition. It has 20 times the suicide rate of the national average. Every person with bipolar disorder has had one in every 3 people with bipolar disorder has had a serious suicide attempt or completion. Not scratching their wrist, we're talking serious suicide attempt or completion. 1 out of 3.
1 out of 3 who is diagnosed with bipolar.
Yeah. And it's one study shows that the suicide rate is 6 times higher than major depression. Why is bipolar depression so much worse than major depression? And part of it is because in bipolar depression, your prefrontal cortex, which is your processing center of your brain, is underactive. So it gets overwhelmed. So you're depressed and on edge.
Yeah.
You're depressed and anxious. Whereas people who have major depression, their prefrontal cortex is overactive. So they're just like blah. And things happening, it doesn't even register for them. So they don't feel good. And they have their own high suicide rates.
They don't have the energy.
But they don't have that reactivity. And I was just at a conference, and I was so glad to hear this new study. They said, you know, who do you think the highest suicide victim is. It's always classically been the older white male who's divorced and is drinking. Turns out it's not that. It's the anxious, depressed person. Depression, people will tolerate for several years before they attempt suicide. Anxiety, less than a year. And you get some person who's depressed who suddenly has anxiety or agitation on top of it, like either develop an anxiety disorder or suddenly, again, something like child's died, you get fired, your spouse
So a
wants divorce.
circumstantial thing added
yes.
into the depression.
Suicide rates are huge with those folks. And so that's what bipolar depression is like. It's like having horrid feelings about and thoughts about yourself and the world and being on edge and being easily triggered. It's a very painful condition emotionally. And what really helped me also with my daughter is she left a 3-page letter. And she said that it wasn't anything anybody had done. She had great parents, she had great friends. It's just she had been depressed for 3 years. She could never see herself not being depressed. And no amount of medications or therapy is going to change that because she had been doing medications and therapy for some time. And now we have even newer and better treatments that I wish we had known or had at the time. What's really sad is some of them were there at the time, we just didn't know it. So, it is what it is. And what's helped me again through it is I knew that we did everything we could. And the other thing that helped me is I started out in internal medicine. So when you work in internal medicine and you work on the oncology ward, you realize there's people with cancer you can't cure. You realize when you're working with when I was in cardiology, when people have had 2 or 3 major heart attacks and 2/3 of their heart have died, you can't do anything with that. You can't do it, no matter what the medications are, you can't do anything with that. And so people have Huntington's chorea, neurology, a progressive genetic illness. You can't stop that. So it helped me to understand that there are certain psychiatric illnesses that we can't treat. A lot of people, I think, who are not very familiar with medicine think that all of them should be able to be treated. And I wish that were so, but it's not. And so that's the other thing that helps me is there's a lot of things that are still outside of our influence. I don't even say control, that's an illusion. But outside our sphere of influence. And some of them are totally outside, that we just can't do anything about it. So, you know what, you do the best you can with what you have. You try to learn from it, you try to grow from it, and you try to move on and hopefully do better the next time. So to me, if I have done the best I could, even if I fail, I say it's still good because I did what I could. To me, failing is not trying. Because if you quit, then there's no chance of success. If you persist, you're almost always successful.
Well, and just find some help, too. That's the other thing. I mean, I know you live and work in this arena, so it's no big deal to you to call somebody up and say, hey, I'm struggling with something, I need to process this through.
Well, I'm human, I still don't like it.
Yeah.
But I'll do it, but I don't like it.
I'm weird, I actually do kind of enjoy it.
It's interesting you say help. It's interesting how help comes in different ways. Obviously, professionals, but also friends and family or lay people if they're healthy themselves. But pets. Interesting how many people I've had that have been depressed and suicidal, but they won't commit suicide because of their cat or their dog. They don't want to leave them alone. So it's like, cool. There's so many interesting things that are coming out. There was a recent study out of Great Britain that showed that people who are anxious, who do even mild exercise, like walking with a friend, an hour a day, 5 days a week, substantially help their anxiety. Even though it's not getting there and, sweating to the oldies or anything like that, it's mild exercise with a friend.
With a friend. That
social component is really, really important. We're not islands unto ourselves.
And yet that's what a lot of people who are depressed or anxious do is they isolate.
They isolate.
That's the biggest problem.
Right. And so it's really important to again, do whatever you can. One of the things that I really encourage my patients to do is look up something called Meetup, It's meetup.com. It was begun after 9/11, and it was to reconnect the community, and it's now exploded into this huge thing on the internet. 95,000 cities involved. You sign up for free, and you list what your interests are, and then this group in New York will tie you to people who have meetup groups in your community that list those interests. And so there's like 2,500 meetup groups in Denver Boulder area.
Wow.
So you can do everything from literally, there's ones on, I started a hiking group 3 years ago. But there's actually just movie-going groups. So you can just go to a movie and then talk about the movie. There's book reading ones. There's even one that's interesting. It's a book and cooking club. So you read a book, and then whatever ethnicity of that book was, you make meals of that ethnicity.
Right. Well, I was in a book group that did that. We didn't meet through Meetup, but it's the same type of thing.
There's underwater photography group. There's anything you can imagine. Yoga groups, meditations, very useful for anxiety control.
My daughter is a music student, and at all of her concerts, you can always tell there are meetup groups there, and they all show up at a certain time, meet in a certain area, and then they go sit together, and then they go out for a glass of wine or whatever after and talk about the concert.
Forming friendships is just the most important thing in the world. I mean, forming friendships, connection. We were never meant to be isolated human beings, and having good friends is vital.
You know, so just before we close, what can you offer? Let's say that there's somebody out there who's really suffering. Maybe they've got a clinical diagnosis of some kind, maybe not, but they're just really suffering. Where do they start?
First thing, they have to own it. And then second is, can they identify what kind of suffering it is? You know, is it best done by a psychiatrist or a therapist or whomever? Don't know that yet. But the first thing to do is, if you're suffering, is to own it. Probably the next thing I do is, if you have someone you're relatively close with, will listen with compassion. Talk with them about what you're suffering with, because when you're in it, it's hard to see it objectively. It takes an outside person to see it more objectively. So the person who's in it themselves might come to a conclusion that's really erroneous about what's wrong or what they need to do. But you and a friend can kind of discuss it and say, hey, you know what, I think you need to go see a therapist, or you know what, this is really affecting you profoundly. You may lose your job over this. You better go get some help from a psychiatrist, because this is pretty significant. And then, you know, I believe in psychotherapy. Probably 95% of my patients I have referred to psychotherapy, because it's vitally important as well. The other thing to also remember is that physical illnesses make you more likely to become depressed and anxious. And mental illnesses make you more likely to develop physical illnesses, because they both increase inflammation. And this is kind of almost another topic, but I'll just touch on it real quickly. But if you have a physical illness, you need to get it treated, because it not only affects your body, it affects your brain. If you have depression, it makes you more likely to have a physical illness. So here's an interesting couple of facts. If you have depression, you're 4 times more likely to have a heart attack, and it's 5 times more likely to be lethal than if you're not depressed. If you have a heart attack and develop depression within the next 6 months, your mortality rate is 16.5% versus 3.5% if you don't develop depression. So you've got to really make sure you take care of the whole body, mental and physical.
I was just remembering that when you told me I had depression, I said, well, that's depressing.
Yes, it is.
Oh, bummer. I don't want to have depression. That really stinks. But facing it and dealing with it and going, okay, I'm depressed.
Now what I do?
Now what do I do? Help me so that I don't have to stay depressed.
And then the other thing is, hopefully a therapist will help you make an inventory of also what your strengths are. A lot of times when people get depressed, they only look at what's wrong. Look at what's right also. What are your resources? What are your strengths? So the main thing is to own it, talk with somebody, and then seek treatment. And again, I know that's hard, because by the time, when I decided for the first time, before I'd even gone to medical school, that I needed to go see a therapist, okay? I decided I needed a therapist. It still took me 7 months to make the call. So it is tough. It is hard to do. But
and
I tell
think
you,
it's tougher for men.
yeah, well, men tend to put things off. I think I've found why women live longer than men, because they go in early, and early diseases are always have a much higher success. And men put it off, and now advanced disease always have a lower chance of success. So I really think that's why.
But there's still success.
There is
and
success.
That's what I want to say is
Yeah.
if you're suffering, do these things.
Yes.
Start getting the treatment now,
Yes.
and get out and live a life.
Yes.
Because there's life after all of
Oh.
these things too.
That's when life starts.
Yeah.
I tell you, I wouldn't go back to the way I was, the way I thought, the way I felt for the Mega Million Lotto. No way in the world. No way in the world. It's a painful existence, and now life is awesome.
Yeah. Well, this is awesome. Thank you so
Thank you.
much for coming here again. I
Thank
so
you.
appreciate it. So thanks to Dr. Larry Sanders, and we will see you next time here on Broken and Brilliant.